Because that's one thing that I remember my daughter, she can't take loud noises, never could take it, even as a small baby.
Isn't that just mercury toxicity?
No, that's Lyme disease.
Oh.
Yeah, I'm almost certain that his daughter got Lyme disease. Yeah. But,
don't be freaked out. Here's the thing about Lyme disease. Let's just put it on the record.
What is it?
It's a disease that people get really scared about. It's just a bacteria that people are freaked out about. But here's what I feel like I've come to know about Lyme disease with these gurus that know the most about it. Almost everybody who's sick has it. The people who don't, quote unquote, have it really just don't have symptoms of it because their immune system is able to keep it at bay. So you can either be terrified of it because you hear the words, or you can simply look at it and go, well, we just have to make the immune system worthy of this battle. It's sort of how I look at it.
yeah, and we have some simple herbs that actually fix it over time.
Why do you think it's Lyme? Is it
Well, just from
little details.
feeling her through you.
Okay. I was going to show you a few charts. I'll do it tomorrow. I don't want you to get late.
Yeah, no, show it to me tomorrow. Yeah, I'm happy to.
Thank you.
It's just just want to talk now about testing, different testing methods.
Here's my only thing with testing. I think so oftentimes it's so much of it's a waste, with the exception of a few.
No. I wanna just limit it to the absolute minimum. What I feel really sort of that moms should be aware of.
Okay.
That either they can do themselves, or
because a lot of these kids, don't you feel like the hair profile is sort of an underutilized thing?
Oh, yeah, no. I wanna just put out the very practical things.
Okay.
Sort of,
And we can put it in a different section, but you definitely feel like it's important. Okay.
I think we should put it here because before we get into it, because I want to separate very clearly the primary issues that everyone has to do, and then the secondary issues that will usually self-correct over time. If you don't have money and time or so, you leave all the other stuff alone, but you do this thing up here.
The core things, right.
And then
and there's that diagnoseme.com. Which you looked at enough to, it definitely feels like it's an inexpensive way for parents to start to.
No, it's just I think it's very sophisticated and complicated. I just want to give some very practical things.
Okay.
Let's just do the.
Are we on? Okay, we're on.
Okay, so
we're starting again this morning with Dr. Klinghardt, and he wants to start with some testing issues.
So I just want to recapture. So we have two major issues in kids with neurodevelopmental disorders. In general, we have the in-stream, the influx of toxins, and we discussed yesterday 5 sources of that. And then we have the mechanisms that are responsible for pumping those toxins back out of the system, and the way these can be impaired. And then we talked about 7 factors that modulate the whole thing. One of them was the structural issues like brain injury or at birth trauma, the bite, the facial development, and how that interferes with lymph drainage and neurological.
So we have that list from yesterday.
So we have that list, and what I want to discuss now, just very briefly, give for moms like some tips how they can diagnose what toxins are coming in and have come in. And so the first issue I want to look at is the heavy metals. And like I said yesterday, there's different sources of it. One is the environmental source of it. What kind of area are you living in? And there is a map that you can get on the internet that maps out the high mercury containing environmental areas in the US. And I don't have that in my mind right now.
I have it. It'll be on the website soon.
And so it's important, I think, that everyone knows, okay, just from the fact that I live in this county in California means that I have a higher exposure to mercury than if I would live in San Francisco or somewhere else. That's something moms need to know. So it's an easy way of tracking that. Secondly, the number of silver amalgam fillings that the mother has during the pregnancy has a direct proportional relationship is how too much mercury is passed on to the fetus during the pregnancy. So this is a simple test. You look in the mouth, in the mirror, and count the number of fillings. It's maybe the most important of all the tests. Now, the mercury load of the father plays a big role. The more silver fillings the father has or has had in the past, the more damaged the detoxification enzymes are of the fetus. We've established a direct relationship with that. Yeah? So dad has more of a genetic damaging effect, mom has a direct damaging effect on the fetus. So these are simple things that any couple can do and just review their own history. Now if dad has been, is a dentist or has been exposed professionally to toxins, usually these toxins walk home with dad after work and are spread in the household. Gesundheit.
Excuse me.
So we have many, many cases where, for example, we have one mom who lost 3 children. And what we tracked it to is that her dad, this mom's dad, worked in a pesticide factory, and every day he walked home, he came home with his coat and his clothes on, dusted in pesticides, and came home and hugged the children and played with them before taking the clothes off and washing and getting himself decontaminated. And this girl accumulated enough pesticides and insecticides that 30 years later we can still find it in a blood test in very high levels, and it killed all her babies, you know, at a young age. So reviewing the history and looking in what you're currently exposed to in your mouth is the least expensive lab work that I'm recommending in the first category. The second part is in terms of the more clinical lab testing. I feel that the hair analysis is the most cost-effective way of determining where a child is at. And yet the trouble with the hair analysis is that none of the labs that I've reviewed are interpreting the hair analysis in the way it should be done from a scientific point of view. An autistic child is in general a non-excretor. That means it has trouble. These molecular biological pumps that pump out the toxins are not working, several of them. And therefore this child will not have mercury in their hair. And therefore the way we look at the hair of an autistic child is we take the hair analysis as soon as there's enough hair to get the required weight. And there's a little scale in the hair analysis test kit that you get. It's a little cardboard you balance over a pencil, and you have to put so and so much hair on it until the scales tip. That's when you have enough weight for the analysis to be relevant. And what we're looking for in a hair analysis is, first of all, there is a great difference between different labs in the values that you're getting. So it's not standardized to a level that has a lot of scientific standing. However, within the same lab, repetitive tests are very reliable in showing fluctuations and changes.
Okay.
And what we're looking for in the hair is very simple. If the mother has had any amalgam fillings during the pregnancy, there should be mercury in the hair of the baby. If the mother
whether
has
they get vaccines or not is what you're saying.
whether they get vaccines or not. If the mother has eaten any fish more than once a month during the pregnancy, there should be mercury in the hair of the baby. If the baby has had any vaccinations containing thimerosal, there should be mercury in the hair.
And as you add those 3 things up, they should have even more.
And if you add those 3 things up, you have all 3, it should be even more.
Okay.
Now, if you look at the hair of the baby and you don't see mercury, with that history, you know you have a non-excretor.
Okay.
And then you can easily move, if you choose to then pay the money on the genetic test. You move from a $25 test to a $400-some test, and do the genetic testing on the detoxification enzymes, the genes coding for the detoxification enzymes, or leave that alone. Just kind of surrender to the fact that yes, I have a kid that has these defects of the molecular pumps, and I need to enhance that. And then when we talk about treatment, you can either use a random protocol, or you can then get more specific on looking at the genes and trying to address those issues. We have not really found that the genes predict the exact right intervention that you need to do.
Okay.
We have much better results using muscle testing
Right.
or intuition or standard protocols in doing that. The genetic test really shows you, yes, there is trouble, and it gives you somewhat of a guidance, but it doesn't really translate into exact action that you can
Okay.
take. You know,
And that's always my thing, is why would you do tests that aren't going to translate into a specific set of action steps?
The difference may be that there is a couple of things in there, like the glutathione S-transferase we talked about yesterday. Yes, we need to push the glutathione levels up. Now, as I will explain later, we do that with high doses of chlorella, which doesn't only push the glutathione levels up in the cells, but also provides all the amino acids for detoxification. It provides all the minerals for detoxification.
Has methyl B12.
It has methylcobalamin in it. It's got folic acid in it. It's got iron in it. It's got copper in it, which some people don't like, but I do. I think it's important. And so we use products that cover for vast range of possible genetic defects, so that the genetic testing isn't so important. But let me just kind of capture the hair analysis. We look in the hair. Are the toxins that we know the child has been exposed to in there, or are they not? If they're not in there or only in very small amounts, we know there's trouble. And then we look at the balance of the good minerals in the hair. If the good minerals are also evened out and in mid-range, we know there is no issue with retention toxicity. This kid is not retaining its toxin.
Okay.
But if the good minerals are all over the chart, some are too high and some are way too low and some are absent, if it's a pattern that goes all over the place, we know this is the pattern of heavy metal toxicity, inability to excrete.
So I know there's a lot of people that talk about doing the GMPS challenge, and it's like a misnomer that you do a chelation challenge and you find what you're looking for. This sounds like a really simple way to determine whether or not a child has
And
metals.
I use a very simple addition to this test. We know when you rub cilantro tincture, it's just alcoholic tincture of the kitchen herb cilantro, if you rub that in the arm, you get a high uptake not only in the lymphatic system, but also in the nerves. It triggers a release of mercury, tin, lead, aluminum from the nerves. And the way I do it, I do a hair analysis on a kid, and then I have them for 6 weeks or 2 months, depending on how fast their hair grows back. I have them rub in a dropper full of cilantro tincture every day, just in both arms, and it gets put on the arm and then rubbed in so the skin gets a little warm, so it gets taken up. That's my challenge.
Okay.
And after 6 weeks to 2 months of doing that, I retest the hair. And if I now see the metals go way up, I know first of all this kid is able to respond to cilantro as a very simple way of mobilizing toxins. And secondly, I know that this kid's excretion mechanisms are quite intact, and it just needs a tiny bit of help. You know? When after the cilantro challenge nothing goes up, there's two possibilities. Either this kid doesn't have any toxic metals, which the history will reveal usually, you know, or this kid is more seriously damaged in terms of the detoxification pathways. You know? In the group 1, when there's no toxins, this is sort of when we're suspecting that it may have been a brain injury at birth or before a pre-birth brain injury. Quite often we find infections in these kids. Other causes of autism other than the narrow view of the heavy metals. You know?
Now, how often do you find that it's actually a brain injury that all of these things won't ultimately rectify? Not very often, do you?
Well, most kids have a moderate brain injury at birth.
Okay.
It's just the part of life, you know, that we have, and that's why we're recommending craniosacral therapy for a few sessions with a good craniosacral therapist on each child that is born.
Right.
Whether they're born with C-section or have a normal birth or a traumatic birth. That goes without saying, and the degrees of that vary, but the brain is incredibly capable of recovering if it is not toxic.